Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory. It makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when we used to lose hair of thinning hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Supratim Karmakar is a well-known dermatologist and has been practicing medicine for over many years now. His MBBS MD in skin specializes in dermatology, cosmetology, and hair transplant. Currently, he is practicing as a consultant dermatology at Wisdom Clinic, Kolkata. Dr. Karmakar has dedicated his career to diagnosing and treating a wide range of hair and skin conditions. By providing personalized healthcare services to his patient, he takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets the individual requirement. Dr. Karmakar is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Doctor, for spending your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you, madam. Thank you, doctor, and
Dr.
thank you for
Hamaisa,
those kind words. Thank you for the
Dr.
kind
Hamaisa,
words.
बहुत बहुत शुक्रिया. And today we are going to talk about like hair care in current scenario. So whenever we talk about hair care in current scenario, the first and the foremost common problem which is faced by all of us, irrespective of gender and age, is the hair loss. So can you please enlighten us with your profound experience, like what is hair loss and what's normal and when to be concerned for?
Okay, approximately most of the individuals we face hair fall on a daily basis. It ranges from 50 to 100 strands per day. But however, if it's more than that, that can be a cause of concern as well. There can be so many causes as we will discuss them as we proceed further. But you have to understand what's normal and what's not. If it's some abnormal hair fall, we need to be concerned and definitely should seek the help of a dermatologist or a trichologist for that matter.
Yeah, doctor. So, doctor, like, are there any alarm sign which we can look for to, okay, now it's time to go to doctor. If you don't take care of these alarm signs, maybe you will have much more hair loss.
Yeah, definitely. Actually, most of the time, we are used to facing some amount of hair loss per day. But however, if it's more than the normal, that is normal for that individual, it's definitely, yeah, it's an alarming sign. Sometimes after a stressful event, maybe after a big illness, yeah, after a certain uh, any mental stress or trauma, this can the hair loss can exceed or due to certain disease processes. Yes, it can be excessive hair fall, and it's actually a subjective issue. Depends on the amount of hair the patient has in his or her head, and so that's on the scalp, and that's how we proceed from there. Actually, the patient should seek treatment if he or she considers it to be abnormal.
Okay, okay, quite interesting. So whenever we feel that it's very abnormal and it's like huge amount of hair loss, so we should visit to the doctor instead of ignoring it. Like, uh, it's okay, let it be.
Before it's too late.
Yeah, before it's too late. Like, yeah, yeah, very informative, doctor. So, doctor, like, okay, now that we know that what's normal and when to be concerned for, the another question which we like most of the common people keep asking themselves, and people who are prone to hair loss, they feel like, why me? Why it's me? And why it is happening to me only? So, can you please enlighten us, like, what are the general causes of the hair loss and why it is happening to people so much?
Actually, the causes of hair fall varies from patient to patient. Actually, there are so many causes. Some, as I've already mentioned, stress induced. Some medical factors can be there, and most important is the genetics. Actually, if a patient has a history of hair fall in their family, the male patients would experience pattern hair loss. Yeah, that which we commonly known as androgenetic alopecia. Yeah, definitely is one of the causes. And however, other factors can be that some drug induced, some prolonged illness, some genetic issues. I already stressed that, and some other important diseases can be the underlying cause. And it's very important to differentiate which is the cause and treat accordingly.
Okay, so the root of the cause should be
Yeah.
consult with the doctor and then take the treatment accordingly. Okay, so doctor, nowadays we are having like stressful life and no time to sleep and eat and continuously working late night. So can a person lifestyle play a role in hair health?
Yeah, definitely. Actually, there are so many ways we can modify the hair fall and control it. Actually, taking good quality care of the hair is important. Taking balanced diet which are rich in omega-3 fatty acids, zinc, biotin like salmons, nuts, eggs. Adequate hydration is very important actually, and getting enough sleep, approximately at least 7 to 8 hours of day. I know it's very difficult in our current scenario, but I'll always advise the patient to take a good night's sleep because it helps reduce the stress. And also uh, refrain from styling of hair too much, because too much hairstyling, too much of everything can damage that. And also use gentle conditioners and shampoos, and take good care of your hair actually. So be aware of that, and good healthy diet lifestyle modifications can be helpful.
Hmm. Okay, so good lifestyle, everything which are good habits, we should follow it to have a good skin and good hair and good health. So, doctor, now that we know that what's hair fall and what are the causes, the another thing which most of the people also don't know, and they keep looking for it, and they also keep confused because there are so many information on social media nowadays. So, can you please elaborate us what are the treatment options available for hair loss? Are there surgical, non-surgical, or any other treatment available for hair loss management?
Yeah, apart from already what I've already said before, like taking good care of your hair, and even after that, if you are not uh, happy with the amount of hair that you are shedding per day, you should definitely seek the help of a dermatologist. There can be so many ways we treat that. First, definitely is a non-surgical ways, and definitely there are surgical ways and other interventions that we can do. Non-surgical ways can be a good amount of dietary supplements that we can give. Obviously, one of the popular treatments that is very very popular both in India and abroad is application topical minoxidil, and other good quality hair serums are there also, and other DHT inhibitors and DHT blockers are there, like finasteride, dutasteride, and everything. Apart from that, we do some procedures like platelet-rich plasma, PRP, LLLT, that is low-level laser therapy, and also if nothing works, all these modalities fail, we definitely have hair transplant.
So wide range of treatments are available, but it is very important that we go to the doctor and get the root cause no instead of being our own doctor.
Yeah, definitely.
Yeah. So, doctor, nowadays, like you said about diet and nutrition is very important. So nowadays there is a word called nutraceutical which is getting a lot of focus. So can you please tell us what is this nutraceutical and what is the role of this nutraceutical in hair health?
Actually, nutraceuticals are a wide range of tablets that are available in the Indian markets. Actually, it contains lots of amino acid, vitamins, minerals, and supplements. And the patients obviously always take over. That's OTC products. Actually, everyone is taking some of the other kind of nutraceuticals in order to achieve good hair. Actually, so some of this work, some of this don't, and obviously it's always wiser to seek the help of a qualified person before you take those nutraceuticals.
These supplements, okay. So, doctor,
Yeah.
on social media and internet, there are so many herbal plant extracts and these phytoconstituent grapeseed and omega fatty acids. So, do they promote hair growth? Are they really helpful?
Yeah, actually, there are lots of papers, lots of studies which have proven that yes, these do uh, promote hair growth, but always the hair loss treatment should be individualized. It should be differs from one patient to another patient. If I'm taking any supplement blindly, it doesn't mean that I'm treating the root cause. Once again, I
Mm-hmm.
always emphasize that the root cause must be treated. If the root
Mm-hmm.
cause is not treated, you will never get good hair. So it's very important,
Mm-hmm.
you have to treat the root cause, and hence every hair fall patient treatment should be individualized for that patient only, and it differs from patient to patient. So yes, not that nutraceuticals are not the answer to
Mm-hmm.
every hair fall. Yes,
It
some
is.
patients do benefit from that, but
Mm,
most of, in my experience, what I've seen, most of them they don't actually, and otherwise they harm the patient because once they reach to us, already
mm,
1 or 2 years they have already lost so many
mm,
hair, and when they come to us, it's very difficult to reverse that actually.
mm,
So I'm gonna say that refrain from having those supplements, and
mm,
always seek care from a qualified
mm.
person.
Okay. So, like a tailored, individual medical treatment is important instead of just taking everything and having no solution to it.
Yeah.
Okay. So, doctor, like when we are talking about these nutrition, there are like too many nutrients, and most of people are like confused about what are these macronutrients. So, can you please explain us like what are these macro or micronutrients, and what are their role in hair health?
Actually, hair is composed of so many amino acids. Actually,
Mm-hmm.
so
Mm-hmm.
theoretically, if your body is full of those amino acids, you should get good quality of hair, and that's what most of the nutraceuticals, most of the hair supplements they focus. Some say that we have this all these 18 amino acids. Some say that we have more than that actually. So actually, whether you require those nutrients is the main important factor to know, because those might not be the nutrients that you require, and there might be other causes of that actually, like any androgenetic alopecia, the DHT hormone, that is the main hormone that is responsible for this hair loss, that's miniaturization of hair. But what the patient is taking, is pumping his body full of all these nutrients, those macro and micronutrients, but in spite of that it's not getting all those benefits, no improvement in hair loss actually. So it's very important to educate the patient that he needs to seek the treatment of a qualified person.
Okay, quite interesting. So, doctor, like you've been saying, it's very important to seek the doctor advice. So, like there are so many nutrients available on social media, and so many people are, telling that these gummies are good for hair health, and this is good for hair health, and people do take these supplements too, thinking that their hair will grow stronger, thicker, and like grow more. So, is it required to take these nutrients as per gender RDA requirement or under the supervision of a doctor, or is it okay to buy these products and use it blindly?
No, as I've already said before, yeah, definitely not. You should not pump your body full of these vitamins and everything. Yeah, hypervitaminosis is one of the main concerns that we face, one of the real challenges actually. But most of these vitamins, they are water soluble vitamins and generally don't cause hypervitaminosis. And yes, other causes might be there, and the main thing is like the patient wants to get relieved of this hair fall actually. So my area of concern is, and my area of focus should be like, you should not take more than what is required for you, because this might lead to some excess side effects which you might suffer from.
So excess of these supplements are also not good. So it's better to ask the doctor like what do I need and
Yeah.
how to take and how much to take. Interesting, doctor. So after like hair loss, another very common problem which is faced by all of us is the dandruff. So is it like very important to take care of the dandruff also, or is it not, or does this dandruff cause hair fall?
Yeah, definitely dandruff is associated with hair fall. But however, what I mean to say that dandruff is not the root cause of hair fall, as people commonly believe actually. Now we have to understand why dandruff is occurring. It's basically seborrheic dermatitis that is happening. It's more of seborrhea, and if this more of seborrhea, that means there is more increased amount of DHT, that is the dihydrotestosterone levels in the scalp actually, and this DHT causes hair fall. So if a person is facing huge amount of dandruff, there's huge amount of seborrheic dermatitis, that means this patient is also having high amount of DHT in the scalp. And since this patient is having high amount of DHT in the scalp, that means this patient will sooner or later face with hair fall. And also we have to understand, not all dandruffs are due to seborrheic dermatitis. There can be other conditions of the scalp like psoriasis and other LPP, also other conditions, medical conditions that we already know about. And they can lead to this dandruff, that which might not be the simple dandruff that you think that's the only shampoos can will take care of them. It's not like that. It might be the another cause that is presenting as dandruff.
Mhm.
Yeah, so every day we always need to consider help from a qualified person.
Okay, so even dandruff is important to take care of, and not leaving it like a normal part of our life. It's very important also for to consult for a dandruff. So, doctor, we also talked we talked about dandruff, we talked about lifestyle, we talked about nutrients, and we talked about hair loss. Another very common thing which is faced by all of us, and I think it is unavoidable, is the stress. So, is there any impact of stress in our hair health? And if yes, then how we can manage the stress in this, this time of era?
Yeah, so we are always, every one of us is always in a rat race, to in order to achieve, we have certain goals, certain targets to hit. Yeah, and yes, yes, obviously, moving forwards, we will have more targets to
Mm-hmm.
achieve actually. So the thing is like, yes, we have to achieve something, but in our mind, we have to maintain the nirvana actually. So yeah, so one can do a meditation in the morning, and whenever he or she has some time actually, getting good amount of sleep, approximately 7 to 8 hours of sleep, as I've already said, is very important. And yes, to practice good quality lives actually, and eat early in the night and take good quality of sleep, and wake up early in the morning. These are the lifestyle modifications which reduces the amount of stress and the amount of cortisol in your blood, and also leads to decrease hair loss actually.
Okay, so managing stress is equally important with diet and sleep. So, doctor, like when we are stressed out, the very common therapy which are given by all our mother is the hair oil massage, and they always tell that okay, get the massage, put lot of oil, your hair will grow stronger and thicker. And people do sleep with oil in their hair for overnight, thinking that next day when they will wake up, the hair will be fully grown. So, what do you think? What's the fact behind this? Like, oiling hair is a boon or a ban?
Actually, again, it depends actually. If your hair is very frizzy actually, yeah,
Mhm,
it gets
mhm,
entangled very fast actually. Yeah, definitely you should put some amount of oil on your scalp, and also
mhm,
you have to understand whether that oil is hurting your scalp nutrition or not. Also, you have to take care
mhm,
of that actually.
mhm,
If that oil is not that good for your hair, don't put it on your scalp. And at present, you can use that for your hair strands to make
mhm,
sure they are not entangled and they are
mhm,
not frizzy. They are
mhm,
always glistening and they are well conditioned, and you can
mhm,
use that. But avoid putting that directly on your scalp, because it might
mhm.
harm the scalp, because
Yeah.
the scalp is responsible for the nourishment of the hair follicle.
Mhm,
So
mhm,
yes, I always advise my patients, yes, you can apply some oil if you want on your hair
mhm,
strands, but
mhm.
make sure you refrain from applying it on the scalp
Yes.
directly, because on the scalp I'll add some hair serums, some lotions that the patient
Mhm,
might need for good hair growth. So yeah, oiling of the scalp is okay. And also you emphasize something about the massage. Yeah, definitely some massage can help, and
mhm,
massage do help actually. But the
mhm,
thing is like, if you are putting too much of tension during the
mhm,
massage, that
mhm,
might approximately lead something known as
mhm.
traction alopecia actually, because of
Oh.
the pull of
Mhm,
the scalp you might experience some amount of hair fall. So the masseuse, the therapist
mhm,
should be
mhm,
well trained to
mhm,
give the right quantity of massage or the good
mhm,
amount of traction
mhm.
of the scalp. So yeah, it's very important to take care of that.
Okay. Okay, so oiling hair can only give a softer look to our hair. It's not nothing like it will grow. It will help to grow the hair.
Yeah, right.
Okay, okay, quite interesting. Now, so doctor, now my favorite part. Can you give us some important tips to manage, like for healthy hair?
Yeah, so healthy hair depends on needs a lot of work actually. Yeah, it's not a lot of work. First important is applying of gentle shampoos. Sulfate and paraben-free shampoos are always preferable, and also good quality conditioners. White tooth combs are also important. Not
Mm,
this narrow tooth combs, and too important to detangle, and for
mm,
deep conditioning of the scalp hair at least once per week is important. You need to take good care of your hair, and only then the hair will remain.
mm,
Balanced diet, I've already said.
mm,
Diets rich in omega-3 fatty acids, zinc
mm,
biotin like salmon, nuts, and eggs. S-
mm,
Staying hydrated is very important. Getting good
mm,
quality of sleep, approximately 7 to 8 hours per day, per day in the night is very important. And also you have to refrain from styling your hair. The more amount of styling, the more amount of cosmetics you are doing, the more amount of bad things are going to happen to your hair. So refrain from doing too much, and just keep it simple. Your hair will be okay. Your hair will thank you eventually. Take good care of your hair.
Okay, so keep it simple and make your hair health fine instead of using those chemicals on your hair and making it more worsen with time. Very interesting, doctor. This discussion was very informative. I'm sure our viewers have found the session very beneficial. So, doctor, can we take some live audience question?
Yeah, definitely. I'm eager.
Yeah.
Go ahead.
Yeah. So first question from our audience is, hi doctor, I'm also from Kolkata. Can I get your appointment because I'm having androgenic alopecia, and since past 2 years, doctors have been prescribing me vitamins and minerals, but I am not getting my hair back. So is there any other way I can get my hair back? And also, do I need to take this vitamins and mineral for my whole life?
Actually, hair loss is a very continuous process, actually. And first, I think you have said that you are suffering from androgenetic alopecia. First, we need to understand whether it is the androgenetic alopecia as a cause or is it some other cause, actually. First, we have to determine the root cause, actually. I guess vitamins and minerals do help, as I've already said. However, there are other modes of therapies like applying lotions and other vitamin, not vitamins, some medications are also helpful. We have some treatment like PRP, actually platelet rich plasma is very, very popular amongst all the people of this generation. Actually, it really does wonders. And so your treatment should be personalized, and you should take help from a very qualified dermatologist, actually.
And he for your appointment, can he Google you and find it?
I think yes, he or she can Google me and find me, actually.
Okay, quite interesting. So another question from our audience is, hi doctor, 2 years back I met in a fire accident and due to that I got a scar on my side head and it's not looking good. I've been trying everything possible to grow my hair back, but it is not happening. Is there any solution for this?
Yeah, actually, this since the patient has developed a scar, actually, what
After
has
the
happened? The hair, yes, after that burn, actually, the hair roots are actually they're destroyed, actually, because of that, actually, and that has been a scar formation, and no topical treatment or no lotion treatment will work in this case. Only her treatment should be a hair transplant, basically. However, the chances of the transplanted graft, to remain there are very not that good, actually, because since it's a scar, it has decreased blood supply, so the graft uptake is not good like in the normal scalp. So he or she should visit a good reputed surgeon who is very trained in doing hair transplant, who is willing to do hair transplant over the scar, actually. So yeah, that's the only solution that I can think of right now.
Okay, so people who have met some kind of these kind of accident, they can go for hair transplant.
Yeah, but again, I'm also emphasizing that hair transplant, the
Qualified.
graft survival, yeah, the graft survival rate is also not that good, actually, because it's a scar already. So yeah, extremely qualified, extremely reputed transplant surgeon should be able to help her in this, his or her, him or her in this case, actually.
It's quite interesting. Another question from our audience is, hi doctor, my daughter is just 12 years old and she has a lot of gray hair. Why is there so many gray hair at such a young age? Can we stop it?
Yeah, actually, gray hairs can be both due to genetics and
Mm-hmm.
also might be due to some deficiencies like vitamin B12 deficiencies, ferritin deficiencies, vitamin D, and also you have to check for the thyroid profile, actually. Okay, so we need to re-evaluate whether it's a genetic or the non-genetical cause. In spite of the most of the cases, is genetics has play up upper hand, and in those cases, is a bit difficult actually to get to the results. And if it's not genetical and have to get treated for these causes that I've already enumerated right now. So yeah, if the root cause is treated, definitely the premature graying, that's the canitis that we call premature canitis, it can be reversed actually.
Okay, okay. So it's better to visit the doctor instead of finding solution by themselves.
Yeah, actually.
Uh, Hi doctor, one person told me that if I apply onion oil and lemon juice, my hair will come back. I have a bald I'm bald from the front. So will this work?
Actually, yes. Actually, what this person is facing is known as androgenetic alopecia, and it's a myth to be saying that onion oil and lemon juice they simple don't work. What is happening that this person has very high level of DHT in his scalp actually, and he needs to get take in oral intake of DHT blockers and other topical solutions. Also, he might need PRP, and if he has progressed extremely towards that totally bald areas, like he might need some hair transplant actually. So yeah, that's of course. And please refrain from taking onion oil and lemon juice. That will not do you any good actually.
Okay, okay. So all these are myths, and it's better to visit the doctor.
Yeah.
Okay, quite interesting, doctor. I'll take one more question from our audience. Doctor, my wife always get angry and she pull her hair, and after pulling hair, there are a lot of patches in her scalp. So can these patches be fulfilled, or hair can come back by its own? And why she pull her hair?
Okay, this is a very important medical condition which is often termed as trichotillomania. Actually, you know that excessive urge to pull his or her hair, mostly seen in the females. And yes, if this patient needs to be treated by a psychiatrist, basically, actually. So the psychiatrist, there's an intense urge to pull the hair. Psychiatry controls that urge. Also, she might need some cognitive behavioral therapy to which will help her or refrain her from pulling the hair when she is having her mood swings. And yes, this is a very good case which will respond extremely well if the patient seeks therapy, and she will get all her hair back, if I'm not wrong.
Okay, so first get the psychiatrist help and then take
Yeah,
the
yeah.
dermatologist
Dermatologist,
help to get
yeah.
the
It's
hair back.
psychiatry should be the first person that she should
That's
consult actually.
quite interesting. So I'll take the last question from our audience because we are running out of time. Hi, doctor. 2 years back, I was diagnosed with tuberculosis, but my tuberculosis is now under control by God grace. But after that, I have been eating a lot of medicine, so now I have a huge hair loss. My mother tell me that my hair loss is because of the medicine. Why it is, and do I need to take any supplement for this?
Actually, what she is facing is like chronic telogen effluvium. That is
Mm-hmm.
after a big illness, after the illness, there is a telogen effluvium like after dengue, after COVID-19. We have always seen lots of patients landing up with hair fall. However, in tuberculosis is a chronic case. So this is a case where there might be two causes. It's a telogen effluvia plus any chronic disease. That's also hair fall due to chronic disease. So it might be the combination of both. And yes, you can take supplements, but better to consult
Visit.
someone before taking those, because you know you are already on some medications right now. Whether the supplements will interact with those medications, we don't know unless and until we're consulting you, or whether we are getting an idea of what you are going through. So again, I emphasize the hair fall should be an individualized treatment, and patient should be treated accordingly, and take good care from a qualified person.
Okay, okay. So after any kind of infection or any kind of other chronic disease, there can be a hair fall, and for that also a person should go to the doctor instead of thinking that "Okay, I got recovered and I if I take the supplement the hair will come back." It's nothing like that. We should visit to the doctor.
Yeah, it's advisable for getting good results, because at the end of the day, we all want good hair
Yeah.
actually. So
Instead of
if that's
spending
some,
money buying those products, it's better to spend money for a doctor and get the right medicine.
yeah, actually, it's a very good point actually, because most of the cases patients spent already hundreds and thousands of rupees before they consult someone,
Mhm.
and already they are running on low budget. So
Budget.
after when they come land up in our clinic, actually the patient is already frustrated and already the scalp is in a very bad state, and we have to recover. He or she has
Mhm.
to recover from that. So
Mhm.
it is very frustrating both for the patient and the doctor when they are using these OTC products actually.
Mhm. So early intervention is the key, and visit to the doctor right time and get the solution, and not to become our own doctors. Quite interesting, doctor. This discussion was very informative, and you thank you so much, doctor. You have shared so much of information. So, would you like to give any take-home message or any other suggestion to our viewers today?
Yeah, my take home message for everyone should be take good care of your hair. And hair loss is a chronic process.
Mhm.
Apply good quality, gentle shampoos. Uh,
Mhm.
Visit your dermatologist, who is a very qualified person for your skin health and hair health, and follow his advice, his or her advice on a day-to-day basis, and
Mhm.
refrain from any OTC products because they do harm you in the
Mhm.
long term and also deplete you of your hard-earned money.
Mhm.
And so you should be very cautious about what you are applying over your scalp, whatever you are taking
Mhm.
too much of supplements is harmful for your hair and for your own health as well. And also try to remain stress free, because
Mhm.
lots of stress are there and there will be stress, and we should
Mhm.
always not let those stress impact our day-to-day life. I wish you all the best.
Quite interesting, doctor. And I think the best suggestion we got today and the take-home message is very like very quite precise and very informative. Thank you so much, doctor, for sharing your all expertise today and answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. Thank you so much, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you so much. Thank you for having me here. I wish you all the best.
Thank you, ladies and gentlemen, for joining us today and asking so many questions and participating so actively. Yes, the time was not enough, but if the doctor have more time, we will reconnect with him, take his appointment for another new topic in hair and skincare. And see you again, doctor. And we'll join again. For now, for today, we are signing off. And have a nice evening, doctor.
Thank you. Thank you. I wish you all the best.